Eiken syndrome is a rare, genetic disorder that primarily affects the bones and joints. It is characterized by short stature, skeletal dysplasia, and specific facial features. This syndrome is named after a significant case study conducted by Dr. Eiken in the 1970s when the first descriptions of the syndrome were introduced to the medical community. Various genetic changes have been identified as contributing to this syndrome, primarily involving mutations in the genes responsible for bone and cartilage development. Individuals with Eiken syndrome often exhibit distinctive symptoms, including disproportionate short stature caused by extreme shortness of the limbs relative to the trunk. This proportionate short stature is typically noticeable in early childhood, leading to delayed development in motor skills. Furthermore, affected individuals may have joint anomalies, particularly in the knees and hips, making it more challenging for them to engage in physical activities. Facial characteristics can also include a flat nasal bridge, a broad forehead, and a slightly prominent jaw. These features, while subtle, can be crucial in diagnosing Eiken syndrome. Healthcare providers typically conduct a physical examination and take a comprehensive medical history, which can lead to clinical suspicion of Eiken syndrome in affected individuals. To confirm a diagnosis, genetic testing can be performed. This testing looks for particular mutations known to be associated with the syndrome and can help distinguish Eiken syndrome from other similar skeletal dysplasias. Early diagnosis is critical, as it allows for the implementation of early intervention strategies. Intervention strategies often involve a multidisciplinary approach, including support from orthopedic specialists, physical therapists, and nutritionists. Physical therapy is essential as it helps improve motor function and provides strategies for mobility and strength training. Furthermore, regular monitoring of bone health can prevent the development of additional complications such as osteoporosis and other musculoskeletal problems. Moreover, individuals with Eiken syndrome may require regular assessments to monitor their growth and development. Nutrition is also an important consideration to support overall health and mitigate some of the challenges associated with short stature. Family education is also necessary as Eiken syndrome is a genetic condition. Understanding the inheritance patterns can help families make informed decisions. The syndrome is typically inherited in an autosomal dominant manner, meaning one copy of the altered gene in each cell is sufficient to cause the disorder. This highlights the importance of genetic counseling for families with a history of the condition. While there is currently no cure for Eiken syndrome, ongoing research aims to better understand the genetic mechanism behind the disorder. This research could potentially lead to targeted therapies that minimize the impact of the syndrome. Individuals with Eiken syndrome can lead fulfilling lives with proper management and support. Many achieve developmental milestones and engage in various activities, especially when provided with the necessary resources and interventions. In conclusion, Eiken syndrome is a complex condition that requires a thorough understanding to manage effectively. Early intervention, supportive therapies, and comprehensive care play crucial roles in enhancing the quality of life for those affected by this syndrome. Ongoing research and education about Eiken syndrome are essential for improving outcomes and supporting affected individuals and their families. If you suspect that you or someone you know might have Eiken syndrome, it's important to consult with a healthcare provider for a comprehensive evaluation. Thank you for tuning in, and stay informed about rare conditions like Eiken syndrome to better understand and support those affected.